Joined now by Dr. Deborah Birx, who served as White House coronavirus response coordinator during the Trump administration. Dr. Birx, I'm so glad you're here with us. You heard Senator Rand Paul. You probably watched some of the hearing today. I'd like your takeaways.
You know, first and foremost, I have worked with Dr. Fauci for a long time, and I know him as an excellent physician and researcher. Let's set that aside and just say and I think the reason why he's in this position uniquely is because he went through the two administrations that really had to handle COVID. And there are people on the left that disagree how the right handle it, and there are people on the right that disagree how the left handle it. And I think Senator Fetterman, got it the most right for all of us. He said, as lieutenant governor, I'm constantly asking myself, did I get the balance right between saving lives and preserving people's livelihoods? And that is a very deep question. And I think what you heard today is still persistent anger over that question not being answered adequately for most Americans. And that's why if we're in public health, we've got to get to that answer. And we have to have a better way forward than this.
And Dr. Birx, are we going to get to that answer by constantly relitigating whether or not this was animal-born or lab-born?
Well, the reason that is important is we do need additional guardrails, because what we've really worked on the issues of molecular insertions and molecular changes, but you can get to the same place, it takes longer, by serially passaging animal viruses in human cell lines. And that's not ever specifically covered in this gain-of-function research. And so we all know that there have been lab accidents. I have seen them myself, and we want to protect the laboratory workers, and we want to protect the community that surrounds that lab. And so there does need to be really additional policy around these issues. And I'm hoping that going forward, we really look at these and have good policies that protect the lab workers, that protect the American public, and really get us ready with trust with the American people. Because right now, if we had a problem, we'd split down Democratic and Republican lines. And I can tell you, there's no county that's one way or the other. And so everybody's at risk in those counties.
It was said today many times by Republicans, or implied rather, that Dr. Fauci was a villain or a monster or someone who had some reckoning to come to because of all the mistakes he made and he foisted on the American public. I'd like your evaluation of that line of criticism.
I think all of us need to be quite honest with ourselves about how not only the information evolved, but the needs for the relevant, what we call countermeasures, should have also evolved. What do I mean by that? When this first hit, we didn't have enough testing out there. We couldn't stop the spread in any way. Hospitals were being overrun. We didn't have a supply chain that matched the need. And so the first part and the few months were a crisis. But once we got additional therapies, monoclonal antibodies, long-acting monoclonal antibodies, remdesivir, where there were actually additional treatments, then you can pull back on some of the mitigation. But because it was an election year, there were states that persisted in their very tight mitigations, and others that showed us a way that you could open K through 12 and higher ed. And I saw it myself. If you gave higher ed tests, they really prevented spread. And so we should have a dialogue about how are we going to do this next time? How are we going to prevent spread? How do we keep K through 12 open? How do we keep higher ed open? How do we keep businesses open? And there's a way to do it. And then we have that roadmap, but we need to get that down in real concrete terms and have both the right and the left agree that that's the best way forward.
Before I let you go, Dr. Birx, you know Dr. Fauci well. In his diaries, it is clear there are times he is captivated by his rising international fame. Is that a recognizable trait of his?
Well, if you've been to his office, you can see that he has a lot of photos of his dealing with high-level influencers and presidents. That is something that means something to him. It doesn't mean something to me, so it's difficult for me to comment. But I don't think that clouded his judgment on what he was trying to do for the American people. We all are human, and I hope we step back and allow Dr. Fauci that humanness, at the same time holding Dr. Fauci, myself, and others accountable to really make this a better response next time.
Dr. Deborah Birx, I appreciate your time very much. Thank you.
Thank you.